everyone, I wanted to do a little overview video about my journey with GERD and LPR, acid reflux, and the LINX surgery, and how I went from discovering the surgery and then going through the process of the surgery, coming out on the other side. So this is kind of an overview of my journey. I'm going to start with explaining a little bit, just GERD, LPR, what that means. So GERD, GERD, I think that refers to the whole acid reflux thing. So the feeling of burning sensation in your esophagus, your throat sometimes, and your heart area, which is basically acid going up from the stomach. And there's another thing called LPR, which is what they call silent reflux, which is side effects that don't actually involve a strong burn. But for me, it was basically something like an acidic gas that goes up still, and it creates a sticky saliva, like a very dry mouth, blocked sinuses for me, and also sometimes the mouth would get so dry, I just get very dry lips to the point where they would burn and get red, and all of that is just from drying up the area. It was also really affecting my voice, and I'm a singer and voiceover artist. I suffered with different symptoms for about 10 years, and gradually it was getting worse, especially the last sort of 2-3 years, where it was becoming unbearable, and I couldn't really enjoy my life because I couldn't eat things and drink and go out and enjoy with friends. That really affected me psychologically as well. So this is when I decided to really search up and try to find a solution. I live in the UK, so I go via NHS, and I was trying to get a surgery via the medical cover in the UK. I was very fortunate to have the surgery done via the NHS. So I'll tell you a little bit again about my journey, because I know a lot of people are searching and looking up information. So when I looked up information, I found obviously the well-known surgery which the doctors usually refer to is called fundoplication, which is where they take a section of the stomach and they wrap it around your esophagus area here to kind of block from acid going up. You can do a full one, which goes all the way around, wrapping from the stomach. You can do a half fundoplication. I don't remember the name, but it's basically just covering half of the area, leaving half of it. So either way, it's quite an invasive surgery, and it's non-reversible. So once you do it, you do it. Good results with that, I think. But it has been causing some issues for people, like issues with belching and trouble puking. Basically, the way up is blocked really hard. So anything that goes up, like burp, will just be a problem. So then I started looking up a bit further, and I found a relatively new surgery from the last 10 years that's called LINX, LINX. And there was information about the surgery, but not as much as I wanted to hear. I think there wasn't enough video about people talking about their journey and about the surgery, which is why I wanted to do this, because I feel like it has been amazing for me, and maybe I can help somebody else out there like me who is Googling, trying to find information about that specific procedure. So what I've done is I went to my doctor, just went to my local surgery, and I talked about my symptoms, and I said, obviously, usually they give you PPIs, those acid blockers. I've been on PPI sort of on and off, and like I said, gradually getting worse over the last 10 years. And I basically told them I've reached a point where this is really affecting me physically and mentally, psychologically. I looked up on YouTube and I said, there's a doctor that I want to see. His name is Nick Boyle. So if you look up LINX surgery, you'll find some videos from Nick Boyle. He's one of the experts in the UK. I went to the doctor and I said, can I see this person, please? Can I be referred to see them under the NHS? So basically they said, well, first there's a normal procedure that we have to follow, which is sending you to one of our doctors, internal NHS doctors, I guess. And you have to do a laparoscopy, which is the procedure where they take a camera and put it up from the mouth, I think, to look into the esophagus. The doctor that did that, I think, put it in his notes that my situation wasn't that bad. I think there are people doing way worse, unfortunately, but it was still heavily affecting my life. So he said he didn't find an hiatal hernia. Hiatal hernia, it's when a section of the stomach is peeking out, so is bulging into the esophagus. He said he didn't find one. And he said I had slight esophagitis, not too bad, which is inflammation in the esophagus area. I said, are you able to refer me to Nicholas Boyle? So he said, no, I'm just going to send my recommendation to your GP, and then you're going to go back to see them, and then you ask them for a referral. So that's what happened. He sent his recommendations back to my surgery. I went to see my doctor again to talk about the results. I said I wanted to talk to Nick Boyle, if possible, about LINX surgery. So we looked him up, and I got a referral. This whole process, I think, was over several weeks, maybe a month and a bit. And then I got to see Nicholas Boyle. So when I met him, we talked about my symptoms, and then we talked about what I've done with the previous laparoscopy. He said he wants to do the test again. Understandable. So get his second point of view. So he did the test again. He did say that he saw a 2 to 3 centimeters hiatal hernia that needed to be repaired, and that I had, again, slight esophagitis, so kind of redness in the esophagus. It was quite irritated. So he did see me as a potential candidate. The other thing he needed to check, which is very important, and I think sometimes that information might not be translated by doctors to other people. He seems to be really an expert. What he did say is that you have to have very good swallowing muscles in order to open and close the LINX when the food goes down. And he said that unless that's tested, you might have problems after the LINX surgery. So I'll talk just shortly about the LINX surgery itself, because you can get information online. But the LINX, it's the size of a ring that you can put on your finger. So it's a ring, it's a black magnet ring. It's put on sort of like a rubber band, so you can stretch it out and it closes back, right? Because the magnets will pull back in. They put it at the bottom of the esophagus, and they fix the hiatal hernia to push the stomach back down, and they kind of put everything back to where it's meant to be, and insert that ring and kind of install it, wrap it around your esophagus. And what it does is, obviously, when you swallow, the pressure of the swallowing will open and spread the magnets apart, food will come down, and it'll close back in. And obviously, because it's flexible, it'll be tight enough to prevent acid reflux from going up. But if you need to throw up, if you need to burp, it'll open up and allow you to do that. So less problems with belching and stuff. The procedure itself is much less invasive. So it's a keyhole surgery. So a few cuts around the tummy, keyhole cuts. They look with the camera, they wrap it around, they stitch it, they close it, that's it. It is reversible. It's not recommended to reverse it. It's not something that doctors would jump up and do, So if you've got issues, there will be another process to see if you need to have it taken out. But for me, psychologically, that was a better option than the fundoplication, because I think it worked better with my state of mind of, okay, I can do this, it's less invasive, I can see how it goes, hopefully it helps, and if it doesn't, it's reversible. So I think just knowing that that is a much less invasive and permanent procedure was helping me through kind of getting through it, because I'm not a person that's used to surgeries. Usually I'm very holistic and natural medicine, but it wasn't helping my heartburn. I tried different natural treatments over the years. I pretty much, how people say, oh, I tried everything. I wouldn't say I tried everything, but I definitely tried a lot. And I didn't see any relief from that. So back to the story. Went to Nick Boyle, did the laparoscopy. He came to his conclusions. We were talking about the swallowing process. So he said he sent me to do a swallowing test. You just drink some water with a straw, and there's a computer that you have a tube put in that is measuring the pressure in your esophagus. I did that swallowing test, and the result came back not that good. So I think I failed with flying colors. And then Nicholas Boyle said, basically, okay, I'm going to give you a treatment to help your swallowing. Now, this is a very important point. I think a lot of doctors don't do that. When I asked later on, I asked the next doctor on NHS, which I'm going to get to, about that process. He said he knows nothing about it. So I think Nicholas Boyle is the expert in these things. And he recommended a special, unique treatment that they found that is basically giving you antibiotics. Of course, my initial reaction, being kind of like a holistic natural medicine person, why do I need to put my body on antibiotics, strong antibiotics too? I couldn't get the connection. But he said, we don't actually know. He said, we've just found out that there is this antibiotic that one of its side effects is that it tightens up the muscles in the esophagus. They still don't know exactly why. It's still being researched. But he said that there is a connection between people who suffer from heartburn for a long time and bad swallowing ability. He doesn't know, it's like the chicken or the egg. So they don't know exactly what comes first. Is it first that you have the heartburn and then your muscles are being weakened, or you have weakened muscles in the esophagus, which causes the LES, the sphincter at the bottom, to open, and that causes more heartburn. So they don't know exactly. It's being researched. But like I said, I had to take that treatment. Eventually, I was talking to my husband. I was like, okay, what have I got to lose? It's basically strong antibiotics, strong PPIs, acid blockers, for 6 to 8 weeks. I said, okay, I'm going to get my body through that, take lots of probiotics and hope for the best. So I did that, and miraculously, lo and behold, I did the swallowing test again, and I passed with flying colors this time, so my swallowing was much better. So as you can see, that definitely worked. I think that's important information because I joined a Facebook group, which I'm going to talk about later on, to help me, to support me throughout the LINX process. And I've seen that other people suffered by not being able to swallow properly after the surgery. And I think that's what probably has really helped me deal with my recovery, because my swallowing was so much better after surgery. I have come back to Nicholas Boyle for my last assessment, where he basically said, okay, you are a good candidate for the surgery. It probably will help you with the acid reflux. I don't know about LPR, so the silent reflux or the gassy thing that I talk about. The surgery is not meant to help LPR. There are no proofs that actually helps LPR. Some people it helps them a bit, some people it doesn't help them at all. But he said it will definitely help you with the acid reflux. So he left it to me. He said you make a decision, if you want to do the surgery. Since this has, I've been considering testing, going through the process for about 4 months, weighing it out, doing research. I was kind of coming to the conclusion that I want to go ahead. That's what I want to do. So I said, okay. So he said, okay, you want to book a date? I said, let's book a date. Then an interesting thing happened. So he sent me to the secretary to book an appointment for surgery. We were going over dates, put a date in the calendar to do the surgery. And then the next thing she says is, okay, so the surgery is going to cost £8,000. Okay. Jaw drop, mic drop. I was in complete state of shock for a moment. I said, sorry? He said, yes, how do you want to pay the £8,000? And I was like, I thought I was getting the surgery under the NHS. Oh, no, the tests and everything, but not the surgery. Now, at some point, I told her, are you sure? Because I know you can get the surgery via NHS. So at that point, she goes, okay, let me ask the doctor and come back to you. So I thought, well, it's a yes or no question. What's there to ask the doctor? But she went into Nick Boyle's office again and came back after 5 minutes and said, no, I'm sorry, you can't get the surgery under the NHS. We're so sorry. And then, you know how when somebody drops a bomb and you kind of start scratching your head thinking, oh, well, am I stupid? Did I misunderstand something? What's going on here? You start really doubting yourself. And I was standing there with my husband. I think I was in shock. So then he started asking questions because I was just saying nothing. And, it took me a moment. But then I said, I'm pretty sure you can get the surgery on NHS. He said, no, you can't get the surgery on NHS. Okay. So at that point I was really confused. I would say disheartened. My husband said, okay, let's take the form and fill it out outside the room. I said, we don't have £8,000. Where do we get £8,000 from? He goes, don't worry, we'll deal with that. Let's just put your details in first. Let's get you on the database, then we'll see where we go from there. I'll find a solution. By that time I was able to pick my jaw off the floor and pick myself up, and I was kind of like, okay, this doesn't make sense. I'm going to search this up now. I looked on my phone, went back to the support group with a quick Facebook group search. There's a search on the side of the group. I put NHS. Of course the post came up, and this is why I started the process, because I saw on the group that other people have gotten the surgery via the NHS cover. I told my husband, I said, well, there you go. I'm going back in. And now I was on a mission. So I was going back into the secretary and I was like, here, you can get the surgery via NHS. And she said, well, I didn't say you can't get the surgery via NHS. I said, but you did. She said, no, I said, we can't do it under the NHS. And so I didn't want to come across too rude, but I looked at her and I said, but that's not what you said. And of course she was trying to defend herself. She said, no, I said, we can't do the surgery via the NHS. I said, no, that's not what you said. So anyways, after the whole rigmarole, the secretary said, okay, sorry about the misunderstanding or confusion. We can't do the surgery here via the NHS, but we can have Nicholas Boyle refer you to Epsom Hospital, to Dr. Nehra, who's the one who ended up treating me, and he's the one who does the LINX surgery via NHS, and he can do a referral for you, including your case of information, and just send all of his tests, results, recommendations over. So I said, okay, that sounds good. She said I can do that immediately. It took about 2 weeks, 3 weeks, so it wasn't actually immediate. I had to follow up on it. I think I ended up ringing Epsom Hospital, ringing Dr. Nehra's office and saying, I've been referred via Nicholas Boyle. Did you get my case of information? So from there, the process basically started with Dr. Nehra. He was very informative. He immediately just did an explanation about the surgery, the pros, the cons, what he recommends. He also talked about the other options, which I thought was really good. I ended up, choosing to go with a LINX surgery. And then he said, okay, so if you're ready to do the surgery, and your swallowing test was also positive, which is the point when I asked him about if he knows about the antibiotics that the doctor has given me to better my swallowing, and he knew absolutely nothing about it. He was a bit alarmed. He was like, why would you take antibiotics? So I actually explained to him what Nicholas Boyle has explained to me and how it actually helped me, but I don't think anybody knows about it. So yeah, like I said, in that case, Nicholas Boyle is quite an expert in what he does. And the next stage was, I think he said, go home, think about it. And if you want to book the surgery, you simply give us a call. So I went home, and I think after about a week, I decided to make the call and book the surgery. So I booked the surgery. Happy days. This is when I want to tell you about the support group. So there's an amazing, amazing Facebook group, and I'm going to put the link in the description, like I said, because these people are absolutely amazing. You basically can go there before the surgery. If you're considering a surgery, you can ask questions. You can help other people once you've had the surgery, and people will help you. So I was very, very fortunate to find that group and to have them help me through this process. So thank you so much, guys. I truly, truly appreciate all that you've done for me to help me through this process. So there's actually a separate video that I've done. I filmed my recovery from right before the surgery to post-op, and then 1, 2, 3, 4, 5 days post-op. So the first week I've filmed, and then I've done kind of like week 1, week 2, week 3, week 4, all the way to the current update. Right, to sum it all up, I'm super happy that I did the surgery. It's been a life-changing surgery for me. I can have fun with my friends again. I can eat what I want. I can drink what I want. I do still have a bit of LPR. I think it's better than it was before. Like, it's much better. But like I said, the surgery is not intended to treat that. Otherwise, if you've got any questions, comments, feel free to comment below. I'll do my best to respond. If you want to sign up for my channel, I'm uploading videos weekly about different subjects. And if you found this interesting, I don't know, maybe you're going to find the rest interesting. Enjoy the rest of your week, and I'll see you soon in another video.